All right, welcome back. We are going to get underway with our second session of the day. And this session is, as you see, about helping consumers effectively this year with coverage options that they may have available and how to sort through all of that. I'm happy to introduce the session facilitator for today, Colleen Harriman. She is a Covering Wisconsin longtime staff person, both a navigator and also serving as the interim health literacy and communications manager as of beginning March of this year. So we are so pleased to have her serving in this role and for facilitating the session today. When she's not navigating or communicating, Colleen is often out walking her dog, reading, or trying to make her family laugh with varying degrees of success. So thank you, Colleen, for being here, and I'm excited for the session, so I'll hand it over to you.
Thank you, Allison. Welcome, everyone. And I'm just so excited. And the last session was just so great. I think about looking for the helpers. And in this moment of trying times, it's just such a positive counterpoint. All these sessions have been wonderful. Anyway, today's session here is about assisting consumers effectively. And this session is designed to help assisters do what they do best in this moment of reduced capacity, tight budgets, and upcoming changes to the marketplace to healthcare.gov that's impacting both consumers and assisters alike. Just a quick reminder, if you have any questions, we have that great Q&A feature that I'll be keeping my eye on to make sure we get your questions answered. And I'm going to introduce our speakers in a bit of reverse order. Okay, so Sharone Assa is a health insurance attorney with the Office of the Commissioner of Insurance, OCI. She has been with OCI for 3 years. She has experience in health law, healthcare finance, clinic management, and healthcare advocacy and outreach. She is joined by Sarah Smith. Sarah is the Director of Public Affairs at OCI. She is responsible for overseeing communications, public outreach, and legislative affairs. Before joining OCI, Sarah was the Communications Director for Senator Patty Schnachter and previously served as the Chief of Staff to State Treasurer Sarah Godlewski. Sarah earned a Bachelor of Arts in History, as well as a Master of Science in Educational Policy from the University of Wisconsin-Madison. Sharone and Sarah's presentation will review other health coverage alternatives consumers may be considering given the expected cost increases for the healthcare.gov plans. All right, so our first speaker, again, reverse order. Our first speaker today is Lynne Thorp, Learning and Engagement Deputy Director at Transform Health. She will focus on best practices and tips and tricks to efficiently and effectively reach and assist consumers. Lynne brings over 2 decades of rich experience in nonprofit development, stakeholder engagement, marketing, communications, and strategic planning. Most recently, as Executive Director of the Dubin Dementia Resource Center, Lynne enhanced the organization's impact through strategic partnerships, program development, and marketing, driven by her commitment to improving health outcomes via educational initiatives. She began her professional career in hospital and clinic administration at MD Anderson Cancer Center. After starting a family and becoming involved in early intervention for children with special needs, she pursued a master's degree in special education. And within 12 years, she coached over 750 families with special needs in Southwest Florida. Following the passage of the Affordable Care Act, excuse me, lost my place. She served as the regional director for the Health Insurance Marketplace Navigator programs across 10 Florida counties. In this capacity, she built a collaborative network of community organizations dedicated to increasing health insurance enrollment, and access to local healthcare resources. Her expertise further expanded at a major local health system, where she developed and implemented a provider-sponsored Medicaid managed care program, acting as the key liaison between the health plan and the Florida Agency for Healthcare Administration. Lynne earned Lynne earned a bachelor's degree in business administration at the University of Texas, a master's degree in business administration from the University of Houston, and a master's degree in special education at Florida Gulf Coast University. And with that, I will turn the presentation over to Lynne. Thank you. I think you need to unmute.
Can you hear me now?
Yep, sounds good.
Could you hear me before?
No.
Oh, okay. Sorry. Good morning, Wisconsin, and thank you for having me. As you can read here, the topic for this part of the session is programmatic efficiencies to assist consumers effectively. As was mentioned, my name is Lynne Thorp. I serve as a Deputy Director for Transform Health, a woman-led, minority-owned national consulting firm focused on health systems change. Transform Health is working with CMS to provide technical assistance to Navigator grantees in federally facilitated marketplaces across the country. And as a former Navigator myself, as you mentioned, it is an honor to be here today. I understand that attendees this morning support enrollment work from a variety of organizations and roles. Thank you for the incredible work you're doing across the state. And while you will see the term Navigator used here throughout the presentation, I think you'll find that the strategies provided will apply to many of your work streams. Today's topic covers promising strategies for assisting consumers effectively and efficiently. As our healthcare landscape changes, and programs and people are adapting to connect people to healthcare with the resources available to them. One of these resources is leveraging virtual communication technology. So we'll learn about things to keep in mind when planning and providing virtual outreach and enrollment activities compliantly, and share resources to equip consumers with using their health coverage effectively. I will not be reading directly from the slides since there's so much to cover, and this deck is packed with resources and links which will be shared with you, along with job aids and worksheets for you to reference later. So let's get started. What do we mean by virtual engagement? Consumer assistance is core to enrollment work, but sometimes helping people virtually is more convenient, especially when traveling is involved and resources are limited. Virtual assistance refers to interacting with consumers and partners through a variety of means, including a good old-fashioned phone call, text messaging and email, to video meetings and social media. As you consider moving more of your assistance to a virtual environment and you're updating your workflows, consider staff skill sets and potential training needs on the platform you are considering. For example, it could be Teams, Zoom, Google Meetup, just to name a few. What type of training support or preparation do you or your team need? The same goes for your consumers. Are they familiar with virtual meetings? Do they have access to Wi-Fi? Understand that their cellular data may be used? And lastly, ensure you are aligning your privacy and security processes with rules and regulations stated in the terms and conditions of your Navigator grant, or align with the policies set forth by your organization. So we're going to have a few, well, let's take a moment first to talk about finding and connecting with likely eligible consumers. When you're engaging with outreach, Your objective is to find individuals not currently receiving services at your example. For example, if you attend a community event with flyers, that would be outreach. When you engage in inreach, on the other hand, your objective is to find individuals receiving other services within your organization. This may include reaching out to consumers you had in the past. Did you keep and store their contact information? How do you plan to reach out to them? Here's an example of inreach, example from when I was a Navigator grantee. My organization, of course, offered enrollment assistance through the Navigator grant, but we were funded separately to provide health education to new mothers. So I had the opportunity to tell our case managers about the marketplace assistance that we were offering so they could share this with the families that they serve. I imagine many of you are already doing things like this to expand your reach within your organization. So this is our first knowledge check. I think Mike is going to put a poll in the chat. Your organization wants to notify the community about open enrollment dates and deadlines, which are not examples of inreach. Okay, the correct answer is D. Attending a community event and distributing flyers about open enrollment would be considered an outreach strategy. Now we are going to shift to partner engagement and talk about why it's important and explore some ideas about how you can engage virtually if you are stretched for time or resources to travel. Successful partnerships are reciprocal, meaning that there is a benefit to both parties. We'll go through some examples in a moment. Partner engagement is a powerful way to reach consumers by increasing your capacity and presence through community partnerships. Your community of partners are important in reaching shared priority populations and will build support and confidence through the trusted and established relationships they've built with those that they serve. Depending on your relationship, there are various ways to effectively stay connected with your partners. Some benefit from quarterly engagement by providing program updates and materials, while other organizations with which you have a deeper referral relationship require more frequent engagement. Some partners value receiving reports like shared data and stories that highlight how the activities like enrollment assistance benefit their clients and support their mission. Remember, communication is fundamental to building and maintaining partners and range from messaging to newsletters, check-in calls, case coordination, data sharing. The frequency and mode of communication will be based on the level of engagement you have established with each partner. So this diagram depicts how you can develop your partnership to meet shared goals and expectations. Following these steps will help you develop a final MOU, or Memorandum of Understanding, where clearly defined roles are outlined. For example, as a marketplace enrollment assister, maybe you have an established MOU with your local hospital, which documents processes related to how referrals will be made, like will they schedule online, over the phone, or just give their consumer your card. Will eligibility screening be included, and what guidelines are they following? The MOU can outline data collection and reporting requirements and include how often you'll meet. This type of process helps get everyone on the same page and rowing in the same direction. Note the questions in the yellow sections. These are important questions to review with your partners to make sure that the process you land on is accessible for both of you and easy to follow. All right, our next knowledge check. What are the 3 promising practices to effectively sustain referral partnerships? Select all that apply. Okay. The answers are A, B, and D. You don't want to always wait for them to contact you first. You may have just fallen off their radar, or they need a reminder. Now we're going to focus on helping consumers virtually. Think through some of the processes that should be in place to help assess when virtual assistance is appropriate and effective. Do you have an intake process in place? For example, have you considered screening questions when the consumer calls in? Consider questions like, do you have access to the internet through a computer or mobile device? We can help you virtually for part or all of the enrollment process. Next, decide what type of tools or platforms you have access to for helping consumers virtually. And are they accessible for your consumers? Let's not forget outreach as well. While traditional in-person community events are often effective, limited resources may make it challenging. This is when virtual outreach, such as presentations like this, electronic newsletters, and social media posting can be a consideration to expand your community presence. Ensuring privacy and security when helping consumers is critical. If you plan to help consumers virtually, what policies and procedures are in place for collecting, storing, and deleting information, much of which contain PII, for example, income verification documents, immigration documents, as we all know, the list goes on. The link at the bottom here to this job aid includes some best practices, model forms, and troubleshooting tips to support you in compliantly delivering virtual assistance. Again, this will all be shared, so you'll have access to these links. Our next knowledge check. Virtual engagement refers to interacting using which of the following? Select all that apply.
And we're going to give people a little extra time than the last question.
Okay, I'm sorry. It's hard for me to see where we are in that. Okay.
No worries. That's part of my job. Thank you.
Okay, thank you, Colleen. The seconds are going by like hours for me when I'm watching it, so.
Understood. So we'll give people a few more moments. Okay, Mike, I think you can share the answers now.
Okay, the correct answers are A, B, C, and F. Basically, virtual engagement focuses on interactions that are not done in person. All right, now that you have planned for providing virtual enrollment assistance and work with partners to establish the referral workflows, let's talk about how we prepare and educate consumers to enroll and use their coverage to support their healthcare needs. What's top of mind for consumers these days? As experienced enrollment assisters, we know it depends on a lot of things, including their individual health needs, their understanding of health insurance, their experience in using health insurance. And there are often a lot of confusing messages out there, which is why your role is so important. While many consumers will successfully enroll in coverage on their own, some will require help. If they do need help, scheduling an appointment is an important first step and can give the consumer guidance on what they need to do to prepare and the time frame in which to do it. Because scheduled appointments are effective, it is important that you have a process in place to make it easy for you to implement in your daily routine. There's a checklist of key steps to follow to prepare for consumer appointments. And while scheduling systems are not required for navigators, people are more likely to follow through and meet and show up to an appointment if it was scheduled beforehand. As a reminder, this will be shared after the presentation. Okay, your schedules are set. You have workflows and links for partners and consumers to make appointments for enrollment assistance and your calendar is filling up with appointments. Now let's talk about preparing the consumer for the appointment to make the best use of their time and yours. This diagram outlines steps to prepare a consumer. Think of this in the context of the other things we discussed earlier. The first step is connecting with the consumer. This may have been done through inReach or outreach, or maybe the consumer found you on an online search. The important thing now is you're connected and they need assistance. To help ensure this appointment will be appropriate, do you have some screening questions related to eligibility to review? Do you have a list to help the consumer be prepared with important information and documents that they may need to be uploaded and links to your virtual meeting? Do you have policies in place for privacy and collecting consent? And lastly, how will you remind the consumer of the appointment? Did you ask them the best way to contact them? Is it email, phone call, text? And can that process be automated? So the meeting was scheduled on your virtual platform, yay. And the appointment is today, and the consumer just joined your meeting. Your camera's on, you introduce yourself, you tell them about the free, unbiased professional assistance we're offering, and collect consent from the consumer and start to follow all of the procedures you put in place to securely collect and transmit documents, share eligibility notices, and review plan options. By the time the appointment ends, you have discussed terms related to income tax like MAGI, APTC, 1095s, just to name a few, and other terms related to health insurance, network, copay, maximum out of pocket, and then explain how health insurance works. So it amazes me, all of that in an hour or two. Incredible. How do you check that the consumer understands all the information? There's a terrific guide at the hyperlink on the bottom of the page. I encourage you to bookmark it after this is shared. Our last topic is health insurance literacy. Health insurance literacy is different from health literacy, and teaching it is fundamental to providing enrollment assistance, so consumers have the ability to understand and effectively use their health insurance to make informed decisions about their coverage. As was just mentioned, it covers a number of complex terms and concepts. An important resource is the Coverage to Care Roadmap, which is free and available in 10 languages. It is a variety of tools and resources to help consumers understand how to use their coverage. There's a link at the bottom here to the resource. Materials can be ordered online or downloaded and shared with your consumers, partners, and stakeholders. And this resource continues to be updated. I remember the first one that was created, and it's really come a long way. There are many consumer protections in place under the Patient Protection and Affordable Care Act that are really important for consumers to understand. The No Surprises Act, for example, protects people who are covered under group and individual plans from unexpected balance billing for certain types of out-of-network costs that aren't covered. These are also known as surprise medical bills. A full list of the protections is included in the links on this slide, along with tips on helping consumers protect themselves against fraud and understanding where to go for help if they suspect suspicious activity related to their marketplace account. Our last knowledge check. It is important to let consumers know how to protect themselves from fraud.
Oh, that's the wrong question.
Colleen, I actually do not have this one in the polls.
Oh, okay. Our apologies.
Well, the correct answer is true. That was an easy one.
Thank you.
Of course. I know we covered quite a bit today. Thank you so much for your time. We identified how to engage with partners and consumers virtually when appropriate. We set up workflows for appointment scheduling and enrollment assistance compliantly, and shared resources on how to equip consumers to use their coverage effectively and understand the important protections in place. All the slides will be shared with you, along with links to worksheets and job aids. I work with an experienced team at Transform Health from around the United States who share my passion for connecting people with health coverage. Listed on the slide are additional training opportunities available. Thank you so much for having me here today, and please don't hesitate to reach out with any questions or additional training needs.
Thank you so much, Lynn. I really appreciate your
Thank you
time
so much.
and your experience and wealth of knowledge. Here, let me do a last minute check, see if there's any additional questions. No, I think we're good. Anyone else have a last minute question they want to put in the Q&A? Give it just a moment. I think we are good. Okay, so now we're going to turn to our next presentation, which is again going to cover those other health coverage alternatives that your consumers may be considering and asking you about in light of the expected increase in premiums. So here to share that information is Sharone, Assa, and Sarah Smith from the Office of the Commissioner of Insurance. And thank you again to Lynn.
Thank you. I'll just share my screen to get our slides up.
Okay.
Assuming everybody can see that.
Looks good.
Great. Apologize, it doesn't look like I can turn my camera on, but you should still be able to follow along with the slides. Oh, there we go.
I think that's been.
There we go. Thank you.
Yeah.
Not a lot to see, you know, focus on the slides, but just so you can follow along, you know, who the disembodied voice is. Yeah, so I'm Sarah Smith. I'm the Director of Public Affairs at the Office of the Commissioner of Insurance. I'm here today with Sharone, who I'll let introduce herself.
Good morning, everyone. I'm Sharone Assa, the Health Insurance Attorney at Wisconsin OCI.
And just to give everyone a quick overview of who we are, what we're representing here today. So the Office of the Commissioner of Insurance was created back in 1870. So our office has been responsible for regulating the insurance industry in Wisconsin for quite a long time. And our mission is to protect and educate Wisconsin consumers by maintaining and promoting a strong insurance industry. So I'll let Sharone take the next slide to give a little overview of health insurance, and then we'll get into some more specific types of products that your consumers might be encountering this year.
Thanks, Sarah. So as you may already have learned at this point, insurance is simply an economic device that transfers risk from an individual to a company. The individual transfers risk, the company accepts a premium, and that's the basic function of insurance. Health insurance specifically covers necessary care across 10 essential health benefit or EHB categories. This is going to become important when we start looking at alternatives to major medical. Broadly speaking, EHBs cover really everything you can think of. The 10 EHB categories are really broad. So we're looking at outpatient, inpatient, ER, meds, maternity, mental health, substance abuse, kind of everything that you think about. Another wrinkle that will become important when we discuss alternatives to major medical is the fact that basically all health insurance these days involves networks of contracted providers, which means that the prices, the charge master or list sticker price that that a patient would see is not. Let me rephrase that. An uninsured patient may face charge master or list or sticker price charges, as opposed to an insured patient who has major medical, whose cost sharing will be based on the contracted reimbursement rate. Next slide, please. So the key takeaways that we'd like to give you for this presentation are that all of the options that we are going to be discussing, either together or separately, do not constitute ACA compliant, comprehensive health or major medical insurance. That doesn't mean that there's anything wrong with any of these products, but simply that they should not be presented as a total replacement for ACA coverage. Next slide, please. So the first type of plan we'll discuss is called a minimal essential coverage or skinny plan. Now, technically, these are just plans that, generally speaking, fulfill the requirement of the individual mandate to own coverage, but do not somehow equate to major medical. In practice, MEC plans or skinny plans usually just focus on preventive services. So they'll tend to cover just what you think of as preventive and wellness. They'll generally never cover hospital surgeries, things of that nature. So I can't recommend when they would be specifically good for one consumer or another, obviously, just like with all these plans. But generally speaking, if a consumer's needs are focused on preventive care and they don't have serious pre-existing conditions, this might be a first place to start.
All right, and I will touch on short-term limited duration plans a little bit. Short-term limited duration plans are defined in the state law as an insurance product. They are supposed to be built as short-term coverage that's a bridge between other coverages, as it sounds like in the name, short-term limited duration, conceived of as sort of filling that gap. So, for 3 months with a potential 30-day renewal, people could get this coverage to bridge between, historically, maybe losing employer-based coverage before they get the next job that also has employer-based coverage or something to that effect. That was sort of the initial intent for what short-term limited duration plans would be for. So this is something that's a regularly either a legislative issue at the state level or something that changes often at the federal level. So you might have heard about CMS changing some of the ways they're approaching enforcing rules around short-term limited duration plans this year as a little bit differently than they did under the previous administration. So it might be something you hear more about from the consumers that you are assisting. So short-term limited duration plans are not subject to ACA protections. So they may deny coverage for people with pre-existing conditions. They have some rating restrictions. So, they're not required to provide that minimum essential coverage under the ACA either. So those things that Sharone was walking through before, a short-term limited duration plan is not meeting all of those standards that other, major medical ACA compliant plans would be, though they are an insurance product that we do regulate in some way. So there's a wide value in terms of the range of these products. We actually conducted a study a few years ago to better understand this market. And there is just a wide range of the things that people might encounter in terms of which claims are covered and the amount of coverage they might be getting with a certain product. So it's an important one that people need to be well informed about, understanding all of the limitations of whatever particular short-term limited duration plan they are considering, because there's a lot of nuance from plan to plan.
Indemnity products are essentially ideally a supplement to major medical, because essentially an indemnity product is basically kind of like the flip of health insurance, like the opposite. So health insurance subjects the insured to specified forms of cost sharing, like co-pays, co-insurance, deductibles, and then the insurer kind of picks up the rest. That's a little bit broad, but the basic point is the patient, the insured, has somewhat predictable cost sharing obligations. Indemnity products essentially pay a specified amount for covered events, such as a certain amount for staying in the hospital, for getting a lab test, things like that. And that is it. So the insured is really is required to pay essentially all the other charges that might result from that appointment or hospitalization or whatever it is. So for that reason, consumers need to, if they're considering an indemnity product, they really need to carefully review the exclusions, the pre-existing condition limitations, annual coverage limits, and really make sure that that the policy is just something that can meet their needs. Kind of like with short-term limited duration, we see a wide variety of indemnity products. Some of them can have really low annual coverage limits and essentially might not really end up being as appropriate as it might initially seem on advertisement. Indemnity products sometimes can be structured to mimic health insurance, which again is not necessarily a bad thing, but certainly requires reading the fine print. I would recommend that a consumer consider specifically whether, how do I put this? Whether an indemnity product, if an indemnity product is paying a provider, that may be a bad sign. Not always, but as this is an income replacement program, essentially, there's no necessary reason why payment has to be made to a provider versus to the insured. And there's not necessarily a reason why networks have to be involved. Again, those are just general points. Each product has its advantages and disadvantages. Next slide, please.
Great. So as Sharone defined a few slides ago, what health insurance is, and as a concept, that is what our agency is responsible for regulating, any of those transfers of risk that Sharone was discussing, and in exchange for a premium, that transfer of risk that exists. There are other types of what we refer to as alternative health coverage arrangements that are not subject to the same insurance regulations because they are not operating as an insurance product. With that transfer of risk in exchange for premium sort of concept that Sharone had defined. It's important to be aware of which things are regulated in that way as an insurance product and which types of arrangements are not regulated in that same structure, because government relation here at OCI, regulation of insurance products, protects consumers from insolvent insurers. So it makes sure that they're going to be financially able to fulfill the promises that they've made. We ensure that they treat policyholders and claimants fairly. Insurance regulation is structured around insurer licensing, producer licensing, product regulation, financial regulation. So it's really important to be aware of which things are operating out there in the market and which opportunities for health coverage that consumers might come across that are not going to be subject to those same protections. Primarily those concerns around market regulation and the financial solvency protection. We wouldn't have oversight or ability to take action if there were situations where a company that was not a health insurer and operated as an alternative health coverage arrangement went insolvent and was therefore unable to fulfill its contractual duty. That's outside of our office's purview. So those are just things that we wanted to make sure we highlighted the differences. There are also some federal laws that don't apply in different situations. Mental Health Parity Act, for example, applies to health insurers. Some of those types of protections that we consider very critical for ensuring access for everyone to get the benefits that they need are not regulations that apply or are required in health coverage arrangements. It doesn't mean the health coverage arrangement might not be an option worth considering for a particular consumer, or that anything is good or bad, but those are things we want to make sure people are making informed decisions about and understanding what they're choosing if they choose an alternative health coverage arrangement.
So healthcare sharing ministries, is an arrangement that gets a lot of buzz because it is often marketed adjacent to health insurance, or sort of as an alternative to health insurance. But strictly speaking, healthcare sharing ministries are nothing like insurance. Essentially, what they are in their purest form is a group of like-minded individuals. Typically, they have the same religious beliefs, although it's not strictly required in that way, but a group of people with a common set of religious beliefs that agree to circulate their medical needs among one another, usually by like a monthly newsletter. So by joining a healthcare sharing ministry, the actual promise being made is that your medical needs, what you might need to pay a bill, are shared with the members of that healthcare sharing ministry who may or may not donate an amount to your needs. As you can imagine, that might ultimately not be what a consumer is looking for. And frankly, healthcare sharing ministries are often the subject of OCI complaints. That doesn't, again, mean that any particular healthcare sharing ministry is good or bad, but simply that to the extent that consumers believe that they're purchasing something akin to insurance or health insurance, they often find out after the fact that that's not the case. Again, there is no requirement actually to pay a specified medical bill in a certain way. And more importantly, healthcare sharing ministries have the ability to fall outside of OCI jurisdiction. We regulate the business of insurance generally. There's an exception for healthcare sharing ministries that can demonstrate that they meet certain exclusionary criteria. So that said, although OCI does look at and investigate healthcare sharing ministries, depending on the particular healthcare sharing ministry, we might ultimately determine that we don't have jurisdiction. That's kind of a long-winded way of saying that this is an option that does not easily fall under the regulation of one particular agency. And for that reason should be scrutinized, I think, relatively closely before joining. Next slide, please.
Right. And I know we're running a little tight on time because we have a few slides left, so I'll keep this one pretty brief. But direct primary care arrangements are also a health coverage arrangement, not an insurance product. Under this arrangement, a provider may, or a patient may pay a provider a regular monthly fee. So there's no intermediary there. It's a direct arrangement with a particular provider for primary care services. So there are situations where there are sometimes arrangements that include access to like lab tests or prescription drugs. And that's something that starts to step toward the territory of an insurance product because those costs are not controlled by the provider themselves, meaning the provider would be taking on the risk of those potential costs and becomes a transfer of risk in exchange for a premium potentially. So it's an area that's growing quite a bit. We have not yet passed a state law specific to direct primary care. It's been introduced a number of sessions in a row, but they do operate in Wisconsin even without a state law having been passed. So it's just another one to be aware of that is not a substitute for an insurance product, is not an insurance product, but is something that consumers may see more of popping up and might be something that they view as a more affordable option for at least primary care and those regular type of visits and vaccinations.
So to recap, comprehensive health insurance, like what we all think of as major medical, employer-based coverage, Medicare, Medicaid, that's, frankly, kind of the gold standard, but we understand that with everything that's going on in today's market, that might not be an option. So your role, agents, navigators, sisters, is just to help consumers understand all their options, help them read the fine print, help them look at the policies, and make informed decisions about the cost of going without or purchasing comprehensive health insurance or purchasing something else that's neither being uninsured nor having comprehensive health insurance. And I will stop here because there was some guidance issued last week by CMS. We probably should have mentioned this a little earlier, over expanding access to catastrophic health coverage as a reaction to the increase in premiums on in state and federal exchanges. So as of now, I was trying to figure out a way to summarize this well, and there's nothing easy to summarize except that catastrophic coverage used to be available in certain circumstances, and they are expanding those circumstances. The definition of catastrophic coverage is essentially, it's like the deductible is as high as the out-of-pocket max. And so it's basically something that'll be helpful in emergencies, but otherwise, except for a couple preventive care visits, you're basically paying out of pocket. So I think this is a developing area. I expect to get more guidance. I expect we'll see more guidance from CMS, but right now it looks like where traditionally catastrophic was available for certain age groups and certain circumstances, that might be expanded. So that would just be an option to look at. Again, maybe not as helpful for someone that is going to the doctor a lot, but it's out there. Okay, next slide, please.
Right. And if Mike, you could, oh. It's a little different than our question, but let everyone review those options. Oh, you can put it back up, Mike, if that's the one you have. It's, you know, true or false. They're all regulated as insurance products, true or false. Wait a little bit.
And once we get the polling question done, now there are 7 questions in the chat. So
Okay.
we'll walk through those as well. Mike, let's give it another moment and then you can share the result.
We can probably go through our last few slides pretty quickly, Sharone, right?
Sure, we're done at
For the question.
We're done in 3 minutes. Is that? Oh, we are?
Yeah, I believe so.
Okay.
Right, right, Colleen?
Yeah.
Oh, all right, then we'll go really quickly.
Yeah.
So basically,
so just I'll just quick address the
sorry.
All of the out of the 5 arrangements noted on the screen, they are not all regulated as insurance products. So the direct primary care arrangements and the healthcare sharing ministry is not insurance products. So, all right, just wanted to address the question result. Go ahead.
Right, of course. Thanks. So the rest of these slides, just to run through them really briefly, are basically tips for searching for insurance. And as you will be passing these on, I encourage you to read through this. Feel free to email me or Sarah with additional questions. But basically, in my position as health insurance attorney, I unfortunately see a lot of scams around the marketing and sale of health insurance and health insurance adjacent products. So generally speaking, I would encourage anyone shopping on their own to type healthcare. If you're in Wisconsin, we use them federal marketplace. Type healthcare.gov into the search engine to avoid, unfortunately, having a lookalike or shadow website pop up that is not actually run by the feds. You can sign up for healthcare on your own through healthcare.gov. If you need to work with an agent, I would strongly suggest looking up that agent. I would also strongly suggest finding a local agent and make sure that your client, is aware of the distinction between navigator, CAC, broker, and agent. And just generally speaking, beware of anything that looks too good to be true, that promises too much. Certainly be very aware, I would say anytime there's any type of high pressure sales tactic, you can almost be certain that there's some type of scam involved. Insurance isn't going anywhere, and there's no reason why anyone has to sign up for insurance in the next hour. Beware of cold callers, and yeah, next slide, please. I'll just run through a couple more tips. Essentially, if you are enrolling insurance by phone, again, I recommend either signing up on your own or meeting with, like, I recommend for a consumer to meet with whoever they're meeting with in person if possible. But if there is going to be a sale over the phone, what the consumer would want to do is get the agent's name, agency, NPN, name of the insurer, get a written proof of what they're buying, then written insurance application, written policy, a written summary of benefits, then put down the phone, do your own research, look up the agent and the agency, look up the insurer. This can all be done on OCI's website. You can see complaints against the agency. You can Google the insurer, see what complaints are generally out there. You can determine if the insurer is a health insurer. You can determine if the insurer is an insurer at all. Some of these entities are not, they're just illegal insurers. And then you can come back after doing your own research and reading all the documents. And then you can call the agent back, verify that the application you're signing is identical to the application you've already reviewed. And that would be my recommendation on the best way to avoid getting scammed. If there is any issue with the sale or with the use of the insurance, whatever it is, I would direct consumers to OCI to file a complaint if they need to. Looks like we are going over time, so I will just stop there. Thank you for your time.
Thank you. This is a very important topic. So we're going to walk through some questions and see how far we get real quickly. So the first question is actually going back to the indemnity plan. There's a question in the chat asking, how does a consumer make sure that the policy and other forms are filed with OCI?
Oh, Sarah, would you be able to take that? Because I know how I would, but I'm not sure how a consumer would.
So are you thinking like to make sure that they are an insurance company that's licensed with us? Is that kind of what the question is?
That's how I interpret it.
Yeah. So actually the same lookup tool that was on, which page was that on? One of these pages right here. I'll highlight it here. We have a number of lookups there, which includes also looking up producers, companies, anybody who is a licensee, including like public adjusters in the property and casualty space. So there's information on the lookup there. So I think if I'm understanding the question, like the particular company that the agent is referencing in terms of selling an indemnity plan, if that's the situation, or the agent themselves, each of those things, including the entity, can be searched on the lookup tool. There is also a system, a public-facing system, to look up the actual policy forms that have been filed with us. I imagine in most cases that's more nuanced and takes more time to sift through than most people will have the time to dig into. But our lookup tool is at least a good place to check that the company itself is licensed in Wisconsin and the agent is licensed in Wisconsin.
Okay. The next one is a scenario. Consumer presents at an out-of-network provider for urgent but not emergency care. Consumer presents her marketplace insurance plan card. Provider is out of network. Provider does not inform the consumer that they are out of network. And then the consumer then refers the consumer to the provider's tertiary care system, also out of network, resulting in the consumer accruing tens of thousands of dollars of out-of-network, non-emergent care. OCI determines that the provider has no duty under the No Surprises Act to inform the consumer that all of her care will be out of network and not covered. Is this how Wisconsin OCI understands the No Surprises Act?
Well, I can answer this because I don't know. I get a lot of No Surprises Act questions. Every situation is unique and it can really depend on the details. What I am understanding from this question is that maybe a consumer, and this happens a lot, was not happy with an OCI determination, in which case I would encourage them my email should be in here somewhere. You can just email me. This is a very nuanced legal question that I can't give an answer to offhand, but I would very much be happy, truly, I mean it, to discuss this issue with the affected consumer or you, Mr. Rust, please email me.
Great. Could one of you share an example scenario of an indemnity product? So the question or the example, the attendee list here, Susie pays $200 a month and goes to the doctor with an indemnity product.
Yes. So an indemnity products are really far reaching. And the problem I have with some of them is that they really do mimic major medical. So let's just talk about them in like their purest form. You can have like a hospital indemnity product that says, we will pay you, the consumer, $500 if you have an overnight stay in the hospital. That's essentially what it is. The premium on that is going to be probably pretty low, like maybe not $200 a month, but whatever it is. You have to check what the out of pocket, or excuse me, you have to check what the max payout is. If like it's really low, it really might not be worth it. The scenarios get really complicated when an indemnity product starts mimicking major medical by paying out in all these different circumstances and also paying the provider instead of the insured. So they just kind of vary. And I would just recommend personally finding a product that pays the insured and has like a really clear policy that's easy to follow. So you can just kind of treat it as what it's supposed to be, which is like an income supplement.
Okay. So then there's a question asking if direct primary care is a subscription service. So they reference the Netflix of healthcare.
So yeah, so essentially it's it's an agreement with the provider themselves. You may have a particular provider who, it's typically family care practitioners. So it's that preventive primary care type of service that don't participate or, chosen not to participate in insurance networks and have gone this other route to be a direct primary care provider and set up an arrangement where, yes, it's essentially like you're paying a membership fee on a monthly basis to receive, defined types of care from the provider. So it's things like saying, you'll get one wellness visit, you get this list of, services associated with a wellness visit, like basic preventive and primary care services. So direct primary care in that way is just a membership for a specifically defined type of service from a particular provider. When it starts to become, like I mentioned, kind of airing into the space of also covering lab tests or, prescriptions, things that are that might cost the provider more, or the fluctuating costs based on a third-party provider like a pharmaceutical producer, then that starts getting into that transfer of risk where the provider is now taking a premium and paying out potentially an uncertain amount of money for services they've said that they will cover, as opposed to just, I'm the doctor and I agree to do this particular care in an office in a way that's defined and understood. So direct primary care arrangements should be clearly defined about exactly what services there are. If they start getting into the space of prescriptions or lab tests, that's when it's something that we may want to hear about. So.
All right, we want to give attendees at least 2 minutes to take a tiny break. We will share the unanswered questions with the folks from OCI, and we will get those back to you. Thank you all presenters, Lynne, Sharone, Sarah. This was a really important presentation, and I'm so grateful for your time and information today. Thanks very much.
Thank you.
Great. Thank you so much. Yes, thank you so much for this really important session. Thank you, Colleen, for hosting this. And we're actually good on time. We have a break from now until our final session of the day starts at 11 o'clock. So take a break, do what you need to do, get up and stretch, walk around. I will mention that we will be putting the evaluation for today's sessions in the chat so that you can access those. Thank you everybody so much for the responses you've already given to yesterday's evaluation. Those are great. We've already been looking at them. So please do share back your feedback on today's sessions. And yeah, we'll be back here at 11 o'clock for the final session, and we'll see you then.